Good evening. Thank you for taking some time to join us today. My name is Sarah Harrington. I am the nutritionist here at Brio Medical Center in Scottsdale, Arizona. It's sunny today. It's finally cooled down rather than being 120 degrees, which is pretty nice. We are here to talk about nutrition. Nutrition and how nutrition can be an ally for you on a cancer healing journey, whether you are going through treatment or you have a loved one that is going through treatment, kind of exploring the healing powers of it, and most importantly, how to personalize your own dietary strategy. As a little bit of a thank you for joining me today, at the end of our talk, we're going to be giving you a little bit of a special present, I should say. We'll be giving you a discount code to our supplement store. So stay till the end and we will pop that into our little chat box. But I don't want to blabber on for too long here. You all tuned in because you want to learn and you want to find out some good things that you can do. So I want to jump in to questions right off the bat. So we had a lot of questions that were submitted beforehand, but I'm going to encourage you all throughout this talk today. If something comes to mind, if I say something, you have a question about it, you want some clarification, please, please, please pop it into the Q&A box. That way I can answer as many questions in the time that we have. Like I said, I'll try to get to as many questions as I can. The ones that I am unable to get to today, we do have a lot of webinars that are lined up in the coming weeks, whether it's with myself or some of our other providers. So we will try to get all of your questions answered. One thing to keep in mind, before we get into things, everything that I discussed today is going to be for general education purposes to kind of give you some insights. None of it should be taken as individual or personalized medical advice. If you are looking for advice that is specific to your situation, you are encouraged and more than welcome to reach out to one of our patient care coordinators so we can get you set up with an appointment with one of our providers so we can assess your situation in a little bit more depth. All right, so starting to see some questions that are popping in, so love that. So we'll get to those, but before we kind of get into some of the live questions, I want to start out with one that was submitted beforehand, okay? And give me a second here. I'm just trying to figure out how to share my screen. Jacob, do you know how to share my screen? Okay. All right, then we'll just go with it. All right, so one question that was submitted before we started today was from, I want to say, Alana. I apologize if your name is actually pronounced Elena, but Alana from Michigan. I'm actually from Michigan originally as well. So Alana asks, is there one best diet that cancer patients should eat? And the quick answer to that is no. There is not one best diet. If there was one best diet, then it would be significantly less confusing to sort through all of the conflicting information out there that exists when it comes to diet. There are a myriad of factors that play into it in kind of determining what the best dietary strategy is going to be for any individual. So I'm going to kind of unpack what the process of determining that is here at Brio for every patient that comes on board with us, and kind of what my process is there. Now, From a general guideline standpoint when it comes to nutrition for cancer patients or cancer survivors, there are a few different groups that have individually created kind of these parameters or guidelines for nutrition for cancer patients and survivors. There's some from the American Cancer Society, the American Institute for Cancer Research, the National Cancer Institute, and I believe the American Society of Clinical Oncology. Among all of them vary a little bit, but they have all of them overarch in a few different categories in terms of patterns and goals for the nutrition for cancer patients and survivors. There's really three big categories in which they overlap. The first goal is to maintain a healthy weight. Second one is to eat a healthy diet, which is, in my opinion, rather vague. And the third one is to minimize side effects of treatment. Those are kind of the patterns that we see in terms of the overarching goals of what nutrition should do. That being said, there are a lot of other things that nutrition can do from a functional standpoint, from a healing standpoint, but kind of from a umbrella perspective, we always want to make sure that we are hitting those 3 points. Now, circling back to kind of what comprises a healthy diet. Now, a healthy diet is gonna be the same across the board. Whether someone is in a state of general well-being, if someone is in a state of disease, the general principles that comprise healthy eating are overall the same. Now, this is actually kind of fun to do, and I encourage you all to do this. Obviously, if you look at dietary guidelines from different countries, they vary a little bit, and it's kind of fun to do. If you kind of look at, for example, the USDA's MyPlate versus the food pyramid from Greece, you'll see some pretty stark differences. For example, Greece's food pyramid actually has olive oil as a food group, rather than in the US, obviously we don't have that. We have dairy and whole grains and whatnot as a food group. But anyway, I digress. The general principles of healthy eating are the same. And no matter what diet you follow for cancer treatment or to minimize your risk or to minimize your chance of recurrence, these are the principles that you should generally follow, right? And these are going to seem kind of vague, but they hold true. And they are to eat a bunch of whole foods, to increase your intake of colorful fruits and vegetables, to choose healthy fats, to stick to leaner proteins, to limit processed food and refined sugars, and to limit or avoid alcohol. Those are just true across the board. But then we talk about what is a therapeutic dietary strategy, and this is where it gets confusing. This is where we start to have questions and we wonder, okay, what's the best diet for me, right? Because there's so many things out there that are touted to have therapeutic benefits or to be the best thing. We have ketogenic diets, we have a plant-based diet, we have a raw food plant-based diet. Nowadays we have the carnivore diet. There's juice cleanses, there's fasting, there's all of these potential things and so-called diets out there. If you think about them, again, all of those are rooted in the same principles that I just said: whole foods, limit sugars, processed carbs, all of those things. So there's patterns among those, but nuances within each of those diets. So when it comes to narrowing down kind of specifically which of those dietary patterns would be best for an individual, we have two tiers. that we kind of go through to unpack each situation and explore different potential dietary patterns for that individual. So in the first kind of tier of consideration is going to be the individual's overall health. Okay, so not just their current diagnosis, but also their weight. Do they have any comorbidities, any metabolic disease, any issues with the microbiome and the assimilation of certain nutrients, high blood pressure, other things that might play in to their current health status, biomarkers, labs, all of these things. Also in this tier is going to be the type of cancer, the location of the cancer, and we'll get into this a little bit more as well, but different types of cancer are also going to respond differently to different diets and different profiles of nutrients in the body, so that's also a consideration. The stage of treatment that individual is in is going to play a role. Just for example, if we're managing a lot of side effects from theoretically chemotherapy or radiation, then that diet is going to look much different than somebody who's not going through intensive therapy at that time, and maybe their diet is a little bit more lax and includes some more variety. Also along that same line, during times of more intense treatment, be that chemo, radiation, treatments that we do here at Brio, like hyperthermia or fractionated chemotherapy, things like that, we might want to kind of hone in on diet and have that period be a little bit stricter. For example, if we're on a ketogenic diet, we want to be a little bit stricter and try to reach those therapeutic levels of ketosis. And then when we're not kind of in those intense treatment stages, we back off that a little bit. So that's also a consideration. And then lifestyle, general lifestyle, exercise, movement, career, all of these things that influence day-to-day activities and nutritional needs. So that's kind of tier one in terms of deciding and understanding what type of diet might be the best for any individual. Then we have our second tier. And nothing on the second tier is necessarily less important than the first tier, but I put it in the second tier. First thing on the second tier is going to be the individual's genetics. Because genetics can play a really big role in our nutritional needs, and also if there are any, what potential dietary pattern might be best for us. Now, when we talk about genetics, genes aren't an individual's destiny, because we have our genes, and then we have how our genes actually behave, which is our genetic expression. And nutrition is a tool that we can use to optimize that genetic expression, which is huge when it comes to cancer, cancer prevention, all of the things. Because there are many genes that code for things like tumor suppression, detoxification, methylation, that can be modulated or improved by increasing or decreasing our intake of certain things. Not only that, there are certain genes that can point us in the direction of what diet might be best for that individual. For example, there are variants in a gene called PPAR alpha, and there's a variant of that gene that if certain people have it, it can make it extremely difficult for that individual to get into ketosis. So individuals with that genetic variation, a ketogenic diet might not be a realistic option for the amount of theoretical work it'll have to take to get them there, when we could potentially see benefits from having another approach. There's also variants in a gene called ACSL1. And this one's actually really interesting because it kind of ties into a bunch of different dietary patterns, ketogenic being one of them. That variant can code for basically if your diet is above a certain threshold in saturated fats, it can actually have negative effects on your fasting blood sugar levels, which isn't excellent, but we don't really think about fat impacting our blood sugar. But for people who happen to have this genetic variation, it potentially can. So genetics are going to play a role. There's also genes that code for our ability to convert plant-based omega-3s into the usable form in the body, genes that code for the conversion of beta-carotene into vitamin A. There's lots of things from a genetic standpoint that will kind of point us in the right direction in terms of what diet is best for us as well. Also on this tier, I was kind of going on about that for a little bit, is micronutrients. What diet was like previously, if there's any giant gaps in terms of our diet that we have to, or in terms of that individual's diet that we want to address to make sure cells have everything that they need in order to function optimally, to optimize the immune system, access to food, barriers to cooking. For example, it doesn't really make sense for someone to try to follow a raw food vegan diet if they don't have good access to good organic produce, farmers market, good grocery stores, etc. Something else, Mediterranean diet might make a little bit more sense. Same with preparing food. And then finally, culture. Food is a huge, and I say this all the time, food is a huge part of our lives and our families and our identities. And maintaining quality of life and our sense of self is extremely important, and to our overall well-being, especially during cancer treatment. And we don't want to stray too far away from that. And I'm a firm believer there's always options. You know, you like a food, there's always ways that you can creatively find a healthier version of that food. May not be exactly the same, but it's close enough that it's going to scratch that itch. But finding those options and making sure your dietary pattern is going to align really with you is important. So kind of a lengthy explanation, but it is a lengthy process. That's why it's not cut and dry. It's why it's confusing and difficult to figure out what the best things to eat are, is because it's so individualized. And again, that's unpacking each of those categories is necessary in order to kind of figure out what is best for each individual. And again, all of those originally proposed dietary patterns have a lot of similarities. A lot of them have limits in terms of limiting certain micronutrients or macronutrients. And it's okay and necessary for the dietary recommendations or the diet that you follow to change and evolve over time. Like I said, based on the stage of treatment that you're in. Just because you were doing something for a while and it was working doesn't mean right now it's still working or still has to, or you still have to force it. It's okay to be adaptive in your approach. All right. So I hope that kind of answers that question. I'm sorry that I don't have the best diet, because there isn't one. But that's okay, because there are ways to figure out what is the best diet for you. We did have a question pop into the chat, which is a very good question from Deb. Does Brio prepare food for patients under active treatment there? And related, is Brio prepared food available for purchase if local after treatment? Good question. So on site, all of our lunches are catered from organic. We do provide lunch daily for the patients that are here under active treatment. We have those catered from local organic restaurants. It's usually a different restaurant a few days a week. Beyond, and we are moving to a new building in January, at which time all of our meals are going to be prepared in-house for the patients. But if you are local, there is we have no affiliation, I just want to say, with this company, but I have vetted and searched and done quite a bit of due diligence in terms of finding options for patients in the area, because a lot of our patients do come from out of town, so they don't necessarily want to go and buy a bunch of groceries and all of the ingredients to stay in the condos or wherever it is they're staying, for the risk that those might go to waste when they go home. So there is a really wonderful company, again, no affiliation with them, but called Cura Kitchen, C-U-R-A Kitchen. Wonderful company, does all organic meals based on different dietary parameters. They can exclude certain ingredients. They do plant-based. They do keto/low carb. They're really wonderful. So if you're local to the Arizona area, that is a really good option. Hope that helps. Kind of answers that. All right. We had another really good question that came in ahead of time, which was from Jose in New York, which was, can you provide a sense of how much different types of cancer are impacted by nutrition in different ways? For example, I understand many cancers feed off of glucose, but that prostate cancer tends to feed more off of meat. This is a really good question, because this kind of ties into what I was just talking about in terms of determining what is the best diet for each individual, because one thing that is a consideration is the type of cancer, because so kind of across the board, hallmark of all cancer cells is their reliance on glycolysis to create energy, their reliance on sugar through anaerobic respiration, because they don't have oxygen present. It's true across all of them, but it's not the only way that they can produce energy. It's generally, in most types of cancers, it's their favorite, it's their preferred way to create energy, but it's not the only one. Most tumors, they can also use a process called fatty acid oxidation. So they can also use fat to generate energy. And there are certain types of tumor cells that tend to be more prone to adapting to this process of fatty acid oxidation. Those tend to be melanomas, prostate cancer, potentially triple-negative breast cancer, liposarcomas, which are actually tumor cells that develop inside of fat cells, potentially ovarian cancer, some types of mouth cancer. There's a few others as well. There's also certain genetic mutations that a tumor cell can have that make it kind of upregulate this fatty acid oxidation pathway rather than just rely on the glucose pathway. And part of that has to do with an upregulation of a protein called CD36, which kind of causes that upregulation to the fatty acid oxidation. And there are some targeted therapies that can kind of work against that. But in those types of cancers, potentially a high-fat diet like a ketogenic diet might not be advisable. But that being said, it's not just it's not just dietary fat that those cells can oxidize. They can also rely on the surrounding adipose tissue. So when you think back at kind of some of those types of cancer that I mentioned, melanomas, ovarian cancer, certain types of breast cancer, in terms of where those are physically in the body, they happen to be in areas that there happens to be more adipose tissue. So cancer cells can kind of develop to theoretically create an environment that allows them to feed off of the surrounding fat cells in the body. So it's not just dietary fat that could potentially be a contribution, but also fat in the body, which is why there's also, if you circle back to the very beginning where I was talking about maintaining a healthy weight, having excess fat stores, obesity, overweight, that is a risk factor for the development of cancer, as well as associated with higher cancer mortality rates. So that also being said, that reliance on the fatty acid oxidation can develop in other tumor types kind of as a method of survival. Cancer cells want to live. They theoretically live. They want to survive. So if you starve them of the two theoretical main fuels, sugar and glutamine, then over time they can kind of start to learn to be a little bit more efficient at this fatty acid oxidation. Okay, which is why I'm personally a fan of doing something which I call pulsing, which works very well for people who are on ketogenic diets or particularly very therapeutic levels of ketosis, which is we don't sustain that for a exceptionally long period of time for the sake of not allowing these cancer cells to necessarily adapt these other methods of energy production. So I hope that kind of gives you a general overview of how that works. Someone asked, anonymous person asked, how much sugar is enough to feed cancer in a day? That's very hard to quantify. I can't say, oh, 30 grams of sugar, or oh, 50 grams of sugar, but we can think about it more as how much sugar is available at any given time, right? Because theoretically, we could have 50 grams of sugar spaced out throughout the day. And throughout the day, there's going to be some competition between the rest of the cells in our body and the cancer cells to kind of grab up that sugar. Versus if we were to have 50 grams of sugar at one time, then suddenly there's excess. Everybody can grab sugar. There's no scarcity, in which case that's a little bit more of something to control, is the glycemic response at any given time, rather than kind of sugar in an overall day, because there's sugar in fruit, there's sugar in vegetables, there's a little bit of sugar sometimes in whole grains. All carbohydrates will break down theoretically into sugar, so it's not so much, sometimes it's not so much, okay, I'm going to have zero sugar at all, as long as we're talking about whole natural, occurring sugar and not processed sugar and sweets and things like that. So hope that kind of answers that question as well. Okay. Got a little heart, so I hope so. All right. Next question. This was a. This one was also kind of on the same line. Vicky from Texas asked if sugar causes cancer. It's a good question. Sugar does not cause cancer directly. There's no research that suggests if you have a cookie, it's going to lead to a cancer cell to grow in your body. However, an excess intake of sugar in the diet can absolutely help to create an environment in the body that is more conducive to the growth of cancer. One of those obviously being obesity, inflammation can also be a risk factor and kind of develop along those lines. I think there's 13, I want to say currently 13 cancer types that have been proven to be linked to being overweight or obese. Thyroid cancer, breast cancer, pancreatic cancer, colon cancer, endometrial cancer, I think ovarian cancer, kidney cancer as well. So there's quite a few, and those are the ones that we've only proven thus far. It's most likely there's quite a few more. And that state of being, not only is obesity and overweight a risk factor for cancer, but that metabolic dysregulation can drive insulin resistance, and high levels of insulin can stimulate cancer cell proliferation. In general, that eating a lot of sugar promotes inflammation. So it does not directly cause cancer, but certainly does not help the overall environment, so to speak. Can be an influencing factor in the overall development. Okay. With me? Okay. Another one we've got. So Paulette wants to know the best foods to aid immunity. That's a good question. There are some levels to that. Because when we talk about immunity, we also want to kind of talk about our immunological resiliency. And our immunological resiliency is basically the ability of our body to remain in a state of health or to recover more quickly after a disease burden or a virus or a bacteria or a toxin. So there are foods that can help to boost our immune system, and there are foods that can help to boost our resiliency. And some of them overlap and some of them are a little bit more specific, because kind of building that resiliency doesn't happen over time. And there are also some foods that kind of therapeutically can be used in the short term to kind of help acute states of either inflammation or illness or what have you. So in terms of some directly immune boosting foods, some include turmeric, which is extremely anti-inflammatory. Garlic as well, which is antimicrobial, it's antiviral. Raw garlic as well is wonderful for helping to boost white blood cells. And if the idea of eating raw garlic is really unpalatable to you, which is entirely understandable, my recommendation for that is to get a jar of, say, vinegar. Doesn't have any kind of vinegar. It could be balsamic, could be white wine vinegar, whatever you like, and throw your garlic in that jar. In that way, the garlic will absorb a little bit of the vinegar. It'll help to kind of cut the flavor a little bit. Thyme's a really good one. The beta-carotene rich foods, so carrots, sweet potatoes, leafy greens, because beta-carotene will convert to vitamin A, which is really important to the immune system. There are some people that don't do that conversion well, as I kind of mentioned earlier. So wild-caught fish, cod liver oil are also really wonderful sources of vitamin A. Now, when it comes to building that immunological resiliency, and for a host of other reasons, we really want to optimize the health of the microbiome. When I say a host of other reasons, the microbiome and the immune system are incredibly interlinked. And I know somebody else had a question regarding that, so I'll circle back to that in a second. But improving the health of the microbiome is significantly important to promoting treatment outcomes. There's a lot of things within treatment that can kind of hurt the health of the microbiome, especially if you're going more of the conventional treatment route. In general, our lifestyle isn't necessarily, just the general, American lifestyle isn't necessarily conducive to excellent gut health. So foods like fermented foods, kimchi, pickles, sauerkraut, coconut kefir helps to, number one, digest your food and also promotes good gut bacteria. Kombucha, which has probiotics. There are some kombuchas that have less sugar than others, so look for those. Aloe vera, which is very soothing to the gut lining. Apple cider vinegar or bitters, both of which can help to stimulate digestive juices and the parasympathetic nervous system. Ginger, which can help to increase nutrient absorption, also soothe the stomach. Turmeric, which I already said, bone broth. Some of those foods can really help to promote the health of the gut, in addition to, there's some supplements that can as well, digestive enzymes, some supplements for mucosal support, probiotics. But in terms of the supplement realm, it's really good to kind of work with somebody, whether that's a practitioner, a nutritionist, an integrative care team, to be able to pinpoint what supplements are safe for you to take, especially if you're on any medications, with any other chemotherapeutic agents that you might be on, or whatever else is going on in your treatment plan, to make sure that whatever you're taking is going to be safe and effective. Like I said, circling back to the question that was related, Shayna asked, or kind of both asked and stated, most of us know what we should be eating, but not what kind of quantities we need on a daily basis or how to get it all in. That is entirely fair. And most have an insufficient gut state, so all the good food and supplements are not being absorbed. Where to start? So like I said, start with the gut. Using some of those things that I just talked about, making sure you're eating a diverse diet with fermented foods, bone broth, turmeric, ginger, using things like bitters or apple cider vinegar to kind of help with the breakdown of those foods, and doing some extra things, whether that is specific probiotics or mucosal lining support, in order to kind of bolster your microbiome. In terms of figuring out how much you should be eating, that's a great kind of point, because this is a concern for a lot of people, especially when it comes to maintaining a healthy weight, whether that's not losing weight during treatment, maintaining muscle mass, what have you. But there are a lot of free resources out there that you can go on, and you can calculate what your estimated caloric needs are going to be. My favorite one to use, and the one that I use very often, is called Chronometer. And I really like that tool because, number one, I find the estimates that software makes to be particularly accurate versus others. There's another really popular one called MyFitnessPal, but I find their calorie calculations to be particularly inaccurate for most people. They seem to be very low, versus Chronometer, it tends to be a little bit more accurate. But it's a really useful tool because in addition to calculating your caloric needs, it also gives you a really comprehensive breakdown of all your micronutrient needs, right? So all of your vitamins and minerals, which are very important, not just the calories, but also the nutrients that you're eating. So it's chronometer, what have you. It's CRONO meter. Someone asked about that in the chat. Can inflammation be removed from your body? Yes and no. There's two camps of inflammation. There's acute inflammation, and we always think of inflammation as just across the board bad. Inflammation is not always bad. There's acute inflammation and there's chronic inflammation. So if you bump your arm or you cut your finger or something, or you have surgery, your body has an inflammatory reaction to that to help you heal. That's good. That's the good kind of inflammation. Now, chronic inflammation is the inflammation that sticks around, that we kind of develop over time. And yes, that is possible for that kind of inflammation to be removed from the body. And there are quite a myriad of ways that can be done. Diet is a huge part of that. There are supplements that can help. There are IVs, infusions that can help as well. Saunas are great, staying hydrated. So it is possible to get to a state of chronic inflammation being particularly low. Again, circling back, maintaining the health of the microbiome is really important in that. The integrity of the microbiome, the integrity of the gut lining plays a really big role in that as well. I'm going to touch on this question because it was asked prior, and I think it's an important one. Someone's asking about dairy, and if dairy should be avoided, or kind of what's the deal with dairy products, because that's also a really controversial one. That's a really good question. I love this question. To admit to my own faults, I personally, I think as practitioners, we kind of learn more things over time. Once upon a time, as a nutritionist and clinician, I was very, very, very against dairy products. I believed that it was meant for baby cows, and dairy was not something humans were meant to consume, and that it was not good for us, and everybody should steer super clear away from it. And then I went to graduate school. And in graduate school, I did quite a bit of research and read a lot of studies and, dove pretty deep down that rabbit hole and kind of stopped vilifying dairy in the way that I had before. That being said, when it comes to dairy, there are a lot of considerations when it comes to dairy products, and whether or not you should include it in your diet. Kind of three main ones. Number one is that close to 70% of people on Earth are lactose intolerant. That means that almost 2/3 of the population has trouble digesting dairy products. If you have trouble digesting dairy products, then that's probably not great for the health of your microbiome. That might be contributing to some inflammation, some GI upset, some gas and bloating, something like that. When what you want to be doing is optimizing the health of your microbiome as much as you can. So that's one thing to consider, kind of how you react to dairy. Second thing to consider is that individuals who have gone through chemotherapy are, even if they weren't lactose intolerant before, tend to have a diminished ability from that point forward to digest dairy. So a lot of symptoms that Some people associate just with chemotherapy itself, whether that be a GI distress, loose stools, things like that, might actually be just from the fact that they're including dairy in their diet and now they are intolerant to it. So that is another consideration. The third one is that dairy can be high in IGF-1, and that can potentially contribute to cancer cell growth. So, consuming a lot of foods that are high in that compound or that chemical might not be ideal. But there are also nuances within that. For example, there are types of dairy products that are lower in lactose or virtually free of lactose, and there are types of dairy products that are lower in IGF-1. And they're, how the cows were raised, what they were fed, all of that will kind of also play a role into how much of those compounds are in the actual products. But in general, harder dairy, so things like ghee or aged cheese, tend to be the safest to consume in moderation. Softer dairy products, so things like milk or cream or mozzarella cheese, tend to be a little bit more risky for all intents and purposes. So, but also kind of a nuanced situation if somebody is experiencing a lot of side effects from their treatment and they are having trouble getting, a lot of solid food down, liquids, soft foods are more comfortable, then at that point in treatment, it might not be the most advantageous to exclude something like Greek yogurt or cottage cheese if those are nutrient-dense items that person is able to eat, and it helps to keep their weight up and get their nutrient intake to where it needs to be. So not necessarily a cut and dry answer. There are considerations in both camps and kind of what is going on with that person and why dairy we may or may not want to be included. Let's see what else we got. Okay, David from Fort Myers asked about fasting. Okay, that's a good question. How long to fast? There are a lot of different ways to approach fasting. And a lot of it kind of depends on what's going to work for you and work for your lifestyle. For example, for some people, they live a really busy life, and so it makes sense for them to be able to skip breakfast every day because they're on the go anyway. And that makes sense, and so fasting daily makes sense to them. And there's some people who, they like their meals with their family, in which case fasting every day doesn't necessarily make sense. I also tend not to love daily long fasting windows for women. Anything necessarily daily beyond like 14 hours, if we're doing it kind of like as a long-term thing, tends to have negative effects on female hormones. So there are various ways you can get benefits from fasting. There are the daily kind of intermittent fasting windows, the fasting for 14 to 16 hours and then having an eating window daily. That is one option. What I find there to be, personally, what I think is a better therapeutic option is to do longer fasts more often. For example, something like an 18 to 24 hour fast, like once or twice a week. That way you're getting more benefits in terms of promoting autophagy, improving your gut balance, reducing inflammation, balancing hormones, regulating appetite, things like that, as well as because fasting has a host of benefits, right? It can help with producing ketones. There's some weight management effects to it. It can reduce side effects of treatment as well, especially if it's around chemo, radiation, things like that. Reduces IGF-1, can prime natural killer cells, and also protect healthy cells against radiation and chemo, which is really, really cool. So there are times for it. There are times for it. There are also times where one shouldn't fast. Absolutely times where one should not be fasting, for example, in cases of cachexia or muscle wasting, right? So fasting, when your body is currently kind of taking its own muscle stores and its own food stores, is not the time necessarily to be intermittent fasting. That's the time to make sure that we're getting on a regular eating schedule. Or if you're hypoglycemic, you have low blood sugar, or even diabetes, those are situations where fasting is probably not wise, and there are other things that you can do to get those benefits, like doing a fasting mimicking diet, or some calorie restriction, like pulsing calorie restriction. So you don't have to fast, but it is a tool, and there are a lot of different ways to do it. So it depends on the person. Someone just asked if dairy contributes to inflammation, how I feel about grass-fed meat and pasture eggs. So does dairy contribute to inflammation? Well, it can. It can if just outright by itself, not across the board. Dairy is not inherently going to be inflammatory, but if you can't digest it well, if your microbiome is compromised, if you're getting poorly sourced dairy, dairy from cows that are fed a bunch of really poor genetically modified food, then yes, potentially that can cause inflammation, but dairy is not by itself inherently inflammatory. It all depends on you and your ability to digest it. Organic and grass-fed meats, much better than the alternative. Also depends on the individual. I'm not, because I know I had some questions about this, I'm not, again, diet's individual to everybody. Some people are going to do very well on an exclusively plant-based diet. Some people are not. Some people need some animal products still in their diet, whether that's wild-caught fish, or pasture-raised chicken, turkey. Chicken can be a little bit hard to source well. You never quite know unless you're raising the chickens themselves or you know someone. So in moderation tends to be okay. What I will say regarding the intake of animal protein is an excess intake of animal protein. Number one, if your microbiome is compromised, can be a little bit difficult to break down, especially, harder to digest animal proteins. If you're eating quite a bit of animal proteins, that can lead to an excess production of ammonia gas in the gut. Ammonia, cancer cells like ammonia. So we don't necessarily want to be creating a ton of that in our bodies, especially if you have a digestive system related cancer, colon cancer, rectal cancer, pancreatic cancer, something like that. You want to be mindful of your intake of animal products for that reason. Beyond animal, foods, what types of foods are going to give us or give an individual the type of protein that they need? And this is from Jeff in Arizona. So obviously, assuming that we don't necessarily want to rely solely on animal products, we can get a lot of our protein from plant-based sources. And plant-based sources of protein are highly anti-inflammatory. They're rich in micronutrients, vitamins, minerals, fibers, all sorts of other things that are going to help to bolster our immune system. And there's quite a lot of plant-based foods that contain adequate amounts of protein for our needs. So guidelines for how much protein we need. These are these have been debated back and forth. If if you were to like Google what are protein needs of, you know, any individual, current guidelines say it's 0.8 grams per kilogram of body weight as the kind of minimum baseline in order to like maintain health. With cancer patients, we tend to increase that a little bit, especially if there's any type of calorie restriction involved, to make sure that we're maintaining muscle mass to 1.5 grams per kilogram of body weight. And that's not to say if there's cachexia, we might want more. It just depends on the situation. The only there's a couple exceptions to that. One would be kidney disease or kidney cancers. Kidney cancer, the kidneys are responsible for processing protein. I call it the 3 Ps when it comes to nutritional considerations for kidney cancer. We have protein, we have potassium, and we have phosphorus. Those all should be kind of considered in terms of developing a strategy for individuals with kidney cancer or kidney disease, just to take some stress off of that organ. But in those cases, we're going to drop those protein recommendations back down to 0.8 grams per kilogram, so we're not overloading that organ. So circling back, plant-based sources of protein. The thing with plant-based sources of protein versus animal-based sources of protein, plant-based sources of protein tend not to have all of the amino acids that comprise a protein. And while that's not necessarily a bad thing throughout a day, you want to make sure that you're getting all of the essential amino acids that you need, because we have essential amino acids that we have non-essential amino acids. Essential amino acids are they are essential because your body does not make them. The non-essential ones your body makes, so you don't have to get them through your diet, if that makes sense. So when it comes to plant-based proteins, you need a variety. So things like beans and whole grains, nuts and legumes. You want a variety of things, but things like for example, if you have an ounce of hemp seeds, that has almost 10 grams of protein. An ounce is about 3 tablespoons, so that's pretty easy to add to a salad or vegetables or something that you've already cooked, or just a bowl of food. Same with beans. A cup of beans has like 15 grams of protein. Even broccoli has protein. About a cup of broccoli has about 5 grams of protein. So chickpeas, soy, sesame seeds, all sorts of good plant-based sources. And then obviously, if you absolutely have to, every once in a while, you can supplement with a protein powder, but it's not necessarily something you want to have to rely on all of the time. So, yeah, so that about brings us to time. So let's see if I can pull up the little chat here. I did promise everyone that you would get, for hanging out with us today, that you would get a code to get a little bit of a discount at our supplement store. So that code I just popped into the chat. It is soursop. Actually, we ordered, the clinic ordered some soursop not too long ago, and we all tasted it. Got some mixed reviews, but they potentially have some really good anti-cancer benefits to them. So that code will get you 10% off at the Brio Medical Essentials supplement store. You can just go on to that website. I will actually type it into the chat here. You can Google it, or if you just type it in as a website, briomedicalessentials.com, that will be valid until, that code will be valid until November 11th at 11/11. p.m. So make sure you get your orders in before that. And yeah, that is going to conclude our chat for today. I am so grateful for all of you joining me today. It was an absolute pleasure. I hope that you got some of your questions answered. I can't see it. How do you spell it? Okay. It is soursop, so it's sour, S-O-U-R-S-O-P. So soursop. Apologies that you can't see the chat. And so yeah, soursop. Again, that's S-O-U-R-S-O-P, all in capital letters. And you'll be able to use that on Brio Medical Essentials. All right. Yeah, again, it was an absolute honor to talk to you all today. If you have questions regarding how to go about treatment at Brio, or if you're interested in becoming a patient, or you have a loved one who you are inquiring about, I encourage you to get in touch with our patient care coordinators. They can get you scheduled for a chat with one of our providers. And I hope that you will tune in to one of our upcoming webinars. If I did not get to your question, I am sorry, but hopefully we can address it in one of our upcoming chats, or if we have a chance to meet. Anyway, thank you again. I hope you all have a wonderful evening. It has been my pleasure, and yours in health.